Our colleagues at the State Lab of Hygiene and our partners at a number of other high complexity labs have been continually doing the whole genome sequencing on residual specimens that come from positive COVID-19 tests. So we have our awareness of what variants are circulating come from that somewhat more complicated process. That one of the caveats, though, is there's a lag to generating that genetic data that we need to understand that. So that's the first point is up until this moment, the sequences that we are detecting are usually from between 2 and 4 weeks ago. So we haven't seen large numbers. I think it's still less than 40 in terms of the cases of the Delta variant. But we've learned a lot, and we're watching the data from the global pandemic very closely. And what we've seen with the Delta variant is that it tends to eventually outcompete or become the dominant strain everywhere that it has had some time to circulate. It was first seen in India, where they had a very severe epidemic over the spring and summer, and then in the United Kingdom and other places in Europe. So we've experienced this before with the Alpha variant, when the initial variant of concern that we had that we observed spread more quickly. It was about 3 or 4 months after it started peaking in Europe that we started seeing it become the predominant variant in the United States. So it's possible, perhaps likely, that we'll see that same pattern. Given time, this variant, the Delta variant, which has a track record of spreading more quickly and sort of pushing out the other variants, could result in seeing that become the predominant strain in all areas of the country. So what are the implications of that? Well, the implications are that it's the risk of becoming infected, given that you're exposed to an infected person, is higher. And for unvaccinated people, that means the risk of becoming, getting severe COVID vaccine is higher than it was with the Alpha variant and with the original strain. So the stakes are higher in a sense. And it's one of the reasons that right now in the summer, we want to encourage everyone to get vaccinated. Now is really the time where we build up our protection so that in the coming weeks and the coming months, or if we see a seasonal surge in COVID-19 activity like we did last year, we have high levels of protection in the community. Because one of the things with more transmissible or more contagious variants is we need a higher percentage of people to be vaccinated to prevent outbreaks and to prevent small cases from growing into the community.